You have just received your body checkup sampling kit. To begin, you need to register your kit using the code located on the side of the kit or on the back of the body checkup card inside your kit. Go to your bodycheckup.com profile, click on Register My Kit, fill in the unique number of your kit that starts with the letters BCU. It is available on your personal card code, Blue Flyer, or on the side of your kit and follow the steps. Caution: save your kit before you start the sampling. We will not be able to analyze your samples if you are not registered. On top of the kit, you will find an envelope containing your DHL ticket, the return manual, and a welcome card. First, open the kit and make sure all the elements are present in the box. You will find the description of each element in the manual. Now listen to the following instructions and information before you start. 1. All samples must be taken within 48 hours from Sunday to Wednesday. Complete the cortisol cycle on the first day, and the remaining samples, preferably in the morning, on the second day, DHL appointment day. 2. The entire sampling process takes 30 minutes. 3. Schedule a DHL appointment the day after your cortisol samples or in the afternoon after your other samples. 4. Before each test, clean your hands. Caution: do not perform these tests if you feel weak. If you feel unwell during sampling, contact a doctor or seek emergency assistance if you feel faint. Before starting this test, contact DHL to ensure the collection of your samples within 48 hours. Let's begin the sampling. For the saliva test, cortisol cycle, get the following 5 tubes. Caution: it is important to collect pure saliva uncontaminated by sputum or gum bleeding. Brush your teeth only after the second sample. If the sample appears pink, it is contaminated and therefore unusable. You can rinse with fresh water and redo the sampling. Opening the saliva tubes may require some force. Pull upwards. The samples are to be taken directly into the numbered tubes from 1 to 5. Pour your saliva up to the 10 mm horizontal line. Make sure to close the tube after each sampling. Follow the order indicated on each tube. 1. Awake upon waking. 2. Awake plus 30 minutes after waking up. 3. 12 p.m. 4. 6 p.m. 5. 10 p.m. for the saliva test. FOT 2. Prepare the tube with the blue cap and the swab. Caution: do not eat, drink, smoke, or chew gum 30 minutes before collecting the saliva sample, which can be done throughout the day. Do not empty liquid inside of the tube. 1. Open the sterile package and remove the swab. Be careful not to touch the tip of the swab with your fingers. 2. Insert the swab into your mouth and rub the inside of your cheeks for 1 minute. 3. After sampling, break the stick at the red break point and transfer the swab to the tube. 4. Do not forget to close the tube tightly after sampling. For the urinary test, prepare the following material: the tube with the yellow cap, the pipette, and the urine collector. Caution: do not rinse the receptacle. Collect the first urine of the morning or the middle of the night. This sample should be taken in your shower, bathtub, or over your toilet preferably. Fill the tube up to 3/4. Here are the steps. 1. Urinate in the urine collector or directly into the tube. 2. If you urinate in the urine collector, use the pipette to fill the tube or pour the sample directly into the tube. 3. Once the tube is 3/4 full, make sure to close it properly. If you have forgotten to make an appointment with DHL, it's not too late. For stool sampling, get the 2 brown tubes and the stool collector. Caution: this should be done outside of any antibiotic therapy, about 2 weeks. Do not change your eating habits. Do not use a suppository. Do not take a laxative. Do not take a transit slow-down medication, such as Imodium, Smecta. The sample should not touch the inside of the toilet, and make sure to collect the stool without urine. Take the tubes with the brown cap, one of which contains liquid. Do not empty it. The tubes have small spoons to fill. Be careful not to detach the spoon. Follow the instructions on the collector to collect your stools in the 2 tubes provided for this purpose. 2 small stool samples are sufficient, not diarrhea. The spoon containing the stools must be immersed in the liquid and the vial tightly closed. Then, turn the vial over for about 15 seconds without shaking so that the stools are well soaked and remain submerged in the vial. Then, take the other tube and take the same sample. For the blood test, prepare the following material: 2 tubes with a red cap, alcohol swabs, compressors, Band-Aids, minivets and lancets. Caution, this test is the longest. We recommend drinking a large glass of water 30 minutes before. Wash your hands for 2 minutes under hot water to facilitate circulation. Activate your blood circulation by staying in motion. Do not hesitate to ask one of your loved ones to prick your finger. This action can be painful. Follow the following instructions to collect. Do some exercise by lifting and hopping in place and pass your hands under hot water for a few minutes to activate your blood circulation. Open the tubes by pulling upwards. Disinfect your hands with the disinfectant wipe. Place the necessary elements for sampling in front of you and open the compress and bandage. Open the lancet and place the finger for the prick on a table. Place the open lancet on your finger and take a deep breath and press firmly. Try the first drop of blood with the compress. Using the minivets, place the tip of the latter on your blood drop horizontally. Collect the blood from your finger. Be careful not to block the violet valve of the minivet. Fill the minivets with your blood. You can also directly collect your blood using the beak on the sampling tube. You can help activate the blood circulation as follows. When these are filled, take the tube and insert the minivets into the tube. Repeat these actions several times with the remaining minivets until the first tube is filled to 1 milliliter. Then proceed with the second tube. Next, disinfect your finger with the remaining compress. Apply the compress on the drop, clean the blood, and apply bandage. When all tubes are filled with the sufficient amount, 1. Place personal card in the return box. 2. Make sure to place all tubes in both carrying pouches. 3. Place these 2 envelopes with U-tubes in safety bag. 4. Close your safety bag and place it in the return box. 5. Close the return box with the 3mm stickers and keep it somewhere at room temperature. Be careful not to expose into the sun. 6. Sticks your detail voucher on the back of your return box to take appointment with DHL. After completing all the steps, you can expect your result within 4 weeks. Caution: book an appointment on DHL at least 24 hours before. Do not send samples after noon on Thursday, during weekends, or the last day or 2 before a public holiday. Do not pay anything to DHL. Transportation is prepaid. Download the Body Checkup app to track samples. Remember that we will need your completed questionnaires to process your result and their recommendations of the doctors.